Level 4 lockdown and the ramped-up vaccine rollout over the last month seems to be bearing fruit, while the health ministries confirm the country has passed the third wave's peak. Now, does this mean we are likely to move to a lower lockdown level soon? Well, we'll hear from the President tomorrow evening as he addresses the nation. So for more on this current infection rate, we join up by Professor Adrian Puren, head of the Center for HIV and STIs at the National Institute for Communicable Diseases. Prof, always a pleasure to have a conversation with you. Let's talk a little bit about these numbers that we're seeing. I mean, on Friday, the acting Minister of Health was speaking about how we perhaps have passed the peak of the third wave. Now, in light of what we faced as a country with the protesting, the lockdown regulations being violated, particularly in KwaZulu-Natal as well as Gauteng, are we past the point of danger and concern as the country, in your opinion?
I think overall, good evening, Faith. I think overall the country has reached the peak. However, I think we just need to make sure that we're looking at the different provinces in particular ways. So I think for Gauteng, Limpopo, and Mpumalanga, they certainly have reached the peak. It would appear that I think the Western Cape certainly looks as if it's flattening as well. And when we look at the Free State and in the Northern Cape again, I think they have reached their peak, but there are still certainly ongoing transmission events certainly occurring. I think the concern, of course, is KwaZulu-Natal. I think there have been these declines, but if you look very carefully, you can see a little inflection point. Maybe that's reflecting, recovery from the disruptions that we certainly saw last week in terms of testing. And so I think we really need to be cautious around that. But still, I think we really need to say, although we've reached this peak, it's still at a high level in terms of the incidence, particularly in Gauteng, Western Cape, and of course Limpopo. There's a high degree of positivity when you look at the numbers of people testing and the positivity rate. So we're not quite out of the woods yet. I think we still have a way to go in terms of what will happen next.
How concerned are you about the number of deaths that we're experiencing every single day? In the last 24 hours, for example, we've seen over 400 deaths. Those are just people. Those are people's families. Those are, lives that have been completely readjusted as a result of this pandemic. Are we paying enough attention to the deaths that are surrounding us?
Yes, I think it is really unfortunate. I think in this particular resurgence, I think more and more people have become aware of the fact that, close family members, friends and colleagues are affected by that, ending up in hospital and in fact dying. So it is of great concern to us. And of course, it's not only the deaths that we are certainly recording, it's also the deaths that we may also not be recording. So again, if you think about people who have been unable to, for example, to present for testing and are actually dying at home. So those are the types of things that we really need to be concerned about, and we are trying to address that through various activities and protocols to make sure that we can account for everyone's death.
And of course now it's about balancing livelihoods against lives, and just simply because of how the economy needs to recover, particularly from the events that happened within the past 2 weeks. I believe of about 20 billion or so has been lost in the economy as a result of this unrest that we've experienced. So in that regard, would easing lockdown restrictions be a better way to almost recover as a country and perhaps just deal with the fact that we are in a COVID-19 pandemic?
Yeah, again, I'm not in that position to make those types of comments. I think it will certainly be an important matrix to take into account what's actually happening around the economy, and as well as with regard to the current numbers. I agree with you that certainly the numbers that are declining are a good indicator. However, I think we still need to just make sure that when we look at our capacity, our hospital capacity, especially the bed capacity, oxygen supplies, bed occupancy, those are key factors that I think also really will inform some of those particular decisions. So it's a fine balance. So perhaps there would be a more nuanced readjustment in order to try and cater for, as you said, that opening up of the economy, looking at, for example, the restrictions that are in place to achieve those specific objectives, but balancing that against the fact that we still have, as I said, substantial numbers and that effect will have on the hospitals and its particular capacities.
What effect, Prof, do you think the opening up of schools will have on the numbers that we're facing right now of COVID-19? Now, the Delta variant, as we've heard from scientists time and time again, is not a variant that is completely immune to children. And children, for example, have been seen to have the Delta variant. And in some instances, they've even been recorded hospitalization as a result of the Delta variant in itself. So in being able to capacitate schools and being able to mitigate against this sort of wave that we're in, what is the best way forward, especially in light of the fact that it's back to school on Monday?
Yes, so my sense again, and I think the Ministerial Advisory Committee has looked at this, I think, fairly carefully and in great detail. And in fact, in effect, children still do not contribute they do certainly contribute to the numbers, but they are not a major contributor to the numbers that we are currently seeing. We've also just had a whole vaccine program that has been focusing on teachers specifically. So I think we should really think about that balance, as you quite rightly say. What is that balance between managing schools as well as the fact that we are having ongoing transmission, and given the fact that children are not a major contributor? So my sense would be, yes, I think the schooling needs to happen. I think we're in for a stark period, given that children, especially large numbers of younger children, have actually missed out on schooling, have missed out on terms of access to meals and so on. So I think those are key considerations for us to say that, given the fact that we've had a vaccine program that is focused and targeted on teachers, so we should have a fair degree of protection. So the vaccines are not perfect, but they can certainly prevent against hospitalizations and severe disease. So given that context and the teachers and the children and their needs, I think it's really critical that children get back to school.
Yeah, and then let's talk a little bit also about the vaccine rollout program. I mean, we've seen it, unfortunately, suffer from severe delays as a result of what we've seen in the past 2 weeks. About 47,000 doses or so of the vaccine completely unaccounted for at this point. Your thoughts around our progress in vaccinating our South African society?
Yes, I think that's a really critical point. You raised the whole point about the Delta variant. So again, I know that there are some concerns that our vaccines may not be entirely perfect, but the current evidence, at least from the UK and other places, certainly do show that, again, the hospitalizations and deaths, or severe disease, is certainly prevented by these particular vaccines, and in particular Pfizer. I know that there's still more detail required around the Johnson & Johnson. So I think, yes, I really would directly encourage people to get vaccinated, and especially those individuals who have just had the single dose of Pfizer, that when your turn comes up for your second dose, that please do have that dose, because I think there's really, sufficient evidence to show that second dose is really a critical dose and will be protective. So I can see that the numbers are certainly increasing in the right direction. So that, I think, is very, very, very encouraging. And I'm sure that the modelers will have a field day in terms of trying to understand, as we roll out the vaccine at this particular current rate, what effect that will have in terms of a possible fourth wave. And hopefully the effects will be to really blunt that particular fourth wave.
Prof, always a pleasure speaking to you. Thank you so much for your time this evening, Professor Adrian Puren, head of the Center for HIV and STIs.